I'm here with Michelle, and she's a registered nurse at Brandywine Hall. She's worked with Alzheimer's patients for 4 years at this facility, and she's had 15 years overall experience, and she's going to educate us in caring for Alzheimer's patients. What caused you to work with Alzheimer's patients?
I've always enjoyed working in long-term care and geriatrics. I have special fondness for the elderly population.
What challenges do you face when caring for these patients?
One of the biggest challenges when you're dealing with Alzheimer patients is coping with behavior issues. And a lot of fear with memory impairment. Often the residents will not remember you after a 3-minute visit, and they become frightened. They don't remember their own family. So just trying to keep them safe. And another really big challenge is just watching the disease progression to go into advanced dementia.
Can you describe typical morning and afternoon care for an individual with Alzheimer's?
It would depend on whether the resident has a higher level of functioning or a lower level of functioning, which would be more advanced with their dementia. A lot of our residents do need to, they need assistance getting out of bed, they need assistance getting dressed. Many need to be fed as they forget how to feed themselves. Some just need basic verbal cueing, supervision with meals and dressing. Other people, our residents, need a lot of assistance with our physical therapy department, which is ambulating up and down the hall, helping them to regain some strength or to maintain some strength. Also, a typical day would include trying to help them maintain a level of continence with urine and bowel, which can be extremely difficult. And also to make sure that they have visits during the day and a lot of recreational activity, that they have a fun day.
How would you compare caring for individuals who have Alzheimer's to those who do not?
Well, the difference in the caring would be to make sure that the Alzheimer resident is safe at all times, as they don't have any safety barriers, safety awareness issues. Try to help prevent falls and any injury to the resident. It's important with an Alzheimer resident that you always maintain a calm environment. They don't understand a lot of hyperactivity, a lot of noise coming from other rooms also. So it's really challenging in that way, just to maintain a calm, soothing environment and to address the many behavior issues, as that we have 60 residents, and that would vary greatly on this unit.
What are the positive aspects of caring for Alzheimer's patients?
It can be very rewarding to help an Alzheimer patient and their family to help maintain an optimal level of function, to provide quality to their life, especially as their disease progresses. It can be very difficult for the entire family and friends, the whole network, to just to try and keep them as happy as possible.
What are the negative aspects of caring for Alzheimer's patients?
Again, that goes back for me with dealing with a lot of the behavior issues. When we do have residents that become easily agitated, they're very frightened. They can also frighten the staff. We have a lot of education with our nursing assistants and our nurses, all the therapists, and just trying to maintain that calm level is very difficult when you're working with advanced dementia. It's possible, but it's difficult at times.
How are the physical symptoms of the disease best managed?
24-hour care, and that's what it also is very challenging, because the physical aspects could be something as simple as brushing your teeth, getting out of bed, going to the bathroom, cutting your food, drinking from a cup, using a straw. Every physical aspect can become a challenge, so it is just continual monitoring to help them maintain their optimal level of functioning.
How are the psychological symptoms of Alzheimer's best addressed?
It's really important that the psychological aspect is continually monitored also. We do have psychologists that are trained in the care of the Alzheimer residents, and we also have a psychiatrist that comes out every week to meet with the residents. He also will assess their medication regimen. The nurses are constantly doing behavior monitoring and assessing for any psychological, any issues from their psychological drugs.
What are some typical medications that you find helpful in treating the symptoms of Alzheimer's?
Two of the drugs that are helpful with memory impairment are Aricept and Namenda. If that is caught actually early on in the Alzheimer's disease, then it tends to be more effective. We do have some of our residents on psychotropic medications such as Zyprexa, Risperdal to help with the agitation. Really trying to keep most of our residents off medications as much as possible. If we do have them on like an anti-anxiety or a hypnotic to help them sleep at night, it would be like for a 7-day trial period, and then we'll go back and do a reassessment. We don't just keep them on the medication on a continual basis. It's constant monitoring and assessing.
Can you describe some do's and don'ts in caring for Alzheimer's patients?
Just, it's really important, like I keep saying, to maintain a calm environment, but I really can't stress that anymore. We do have to provide a lot of education for the staff and family members. It's continual maintaining that. One of the don'ts is to try not to upset a resident by sometimes just coming up from behind them could scare them. Just entering their room, you might be a complete stranger even though you've been taking care of that resident 5 days a week for 5 years. That person might not recognize you. So even just always be aware of the fear factor and the safety issues, constantly maintaining the safety issues.
What would you say is the most important thing that new nurses should remember about caring for Alzheimer's patients?
Working on an Alzheimer's unit is totally different from like when you're in nursing school and you're working on a med-surg unit and everybody pretty much goes home in a few days. This is where they live. This is their home. This is their home for the rest of their life. And I think that's really important that when you come to work every day and you maintain that respect, help the resident to maintain their dignity, guide their families through a really difficult process as they watch their loved ones' Alzheimer's disease progress to advanced dementia. And just always bring your compassion to work with you. Be patient with your co-workers. Be patient with all the other residents. Sometimes people will have a day where they're just more anxious, more agitated, and it's important for the nurse to always be calm and to continue to educate herself or himself on the many aspects of Alzheimer's and treatment.
All right, this concludes our interview, and I'd like to thank you for sharing your time and knowledge.
I really enjoyed meeting you both, and I wish you the best of luck. Nursing is a great career. I would encourage anybody that has compassion and love of mankind to come join us. There's so many aspects. Never have a boring day.
All right,
a lot of opportunities, so good luck.
Thank you very much.